Hey everybody, Mike Russell, the physical therapist with the Limb Plastics Institute. Are you guys ready for week 4, right? You're a month into this. Let's start talking about the new exercises and the new system that you're going to be into. Here we go. All right, everybody, Mike the PT here with you again. We're at about a month into your surgery, okay? And I'm sitting here in front of the iconic Limb Plastic Institute board. This is where you take your picture with Dr. Debbie Parshad pre-surgery, and then after your 3 inches or so of lengthening. So wanted just to tell you and kind of update you on sort of what the process is at this point. After about 2 to 3 weeks post-operative, you're starting to get your pain under control, okay? So you're weaning off pain medication, you're increasing your activity, and you're becoming a lot more functional, okay? You're able to stand up, move around, and get around a little bit easier with some soreness that's coming from the lengthening process. We can't change that, of course. The pain post-operatively is different than the soreness that you feel in your quads or in your lower leg area, depending on if you had the femurs done or the tibias done. So what we're looking to do now is to just build on what you have. In the first 2 to 3 weeks, we're working on quad strength and flexibility. Now we're going to start or continue to build on the flexibility components. Quads are getting tight. Not so much hamstrings. Some people think that the hamstring should be the emphasis, and sometimes some physical therapists, when you go home, are really emphasizing and pulling on those hamstrings. Not as important as it is the quad muscle, getting the hips to loosen up and get some strength there, as well as the quads, okay? So I'm going to demonstrate to you, we're going to be continuing and building with strength during the straight leg raises, implementing the hip rotational exercises, as well as getting more on your stomach-based exercises to work on the posterior chain and to work on the stretching on the quads, okay? So we're getting ready to head into the clinic, and I'll show you guys what we're doing. All right, here's our first exercise. It's called the long arc quad. You're just basically sitting on the edge of the bed with your feet off of the ground, extending your knee, and you are able to use ankle weights for this one. The second exercise is called hip external rotation, and this may require the assistance of somebody, or you can tie the band off to a side of a table or your bed. Once again, a little assistance may be necessary, but this is a hamstring curl, so you're pulling your heel back, trying to flex your knee. This is hip extension, so you'll be on your stomach now. You can use the weights. Initially, I would suggest you do not. Both legs, 2 sets of 10. This one's really important. It's laying on your stomach, pulling the heel towards your butt, getting that quad stretch. And lastly is the leg press. And we're using a heavy resistance band for this one. Just talked about some of the exercise strategies from the bicycle to the bed exercises that are all body weight support with the use of ankle weights and bands for right now, okay? And you're not going to get into much more anything beyond that until you're past that consolidation point. So you fully lengthened and then consolidated, okay? But we also get to start working on what we call gait training. This is where we're going to go from a walker, nice, safe, stable walker that you're really comfortable with, standing, walking around your apartment or hotel room or home. We're going to start getting you more to those forearm crutches. And we talked a little bit about those last time on how it does take a little time to get used to them. The stability component of a forearm crutch is a lot less than a walker. A walker has 4 points of support. Crutches have 2. So I wait a little bit of time. I let your let you get the pain under control, get the meds under control, and then start training you in this process and start to build on some balance, okay? So you're gonna start doing some short distance walking, and then we will start working on steps and stairs. Really important, and it's a lot of fun. You just got to be careful. Do this training with your physical therapist. If you're with me, we're going to do it here in Las Vegas. If you're wherever you are and you've gone home, please, this is the time to use the physical therapist to train you on this. You still have to use one crutch and a railing on a step and stair. And then you also have to be very careful coming down because of the pressure or the weight that you could potentially put on the nail. You're at the 4 weeks time frame, so the nail's not terribly long, but when you get closer to finishing your lengthening, the nail's long and more susceptible to injury. So those are the times that you want to make sure you're being careful and using the crutches or the walker appropriately. So enjoy gait training. All right, so we're at 4 weeks of lengthening. We're finishing up with the physical therapy component on that 4 to 6 weeks, and you can kind of push it into 8 weeks just a little bit. Remember, at this point, if you're home, not in Las Vegas still, make sure you follow up with your physical therapist. That's going to be real important for you to do. Also, have the physical therapist reach out to me for protocol, for an update on what they can be doing for you and what they should not be doing, right? Make sure you're doing your home program. Your home program is just as important as what you're doing in the office, the clinic, or wherever you're at, or the gym, okay? So from Limb Plastics Institute, enjoy your this month period of being post-operative, and we'll see you in the next month.